Southbridge. This is Denise Clements from Southbridge Community Television, coming to you from our wonderful studios here on 41 Elm Street. Today's program has a topic that all of us deal with, but very few of us understand: pain. We have two special guests from UMass Memorial Harrington with us, Dr. Jessica Mack, MD, and Dr. Sean Stevenson. Both are board certified in physical medicine and rehab, better known as PM&R. And they are going to explain to us, some of the ways in which we can all deal with pain management. Welcome, welcome. Glad to have you here. Could we start with one of you and give us a little bit of background on how you came to the local area and what you do?
Yes, great. Thank you for having us. So I've been at UMass Harrington for almost 2 years. It'll be 2 years in February. Joined Dr. Stevenson, who's our medical director, and we are developing a physical medicine and rehabilitation spine and musculoskeletal clinic.
Very good. And Dr. Stevenson?
Yeah, so I've been here about 4 years. I'm originally from Massachusetts on the North Shore. Moved away for training and come back to the area because of family mostly.
Nice, nice. Well, again, we're glad that you took time out of your busy day to talk to the people here of Southbridge and beyond about pain management. So, Dr. Stevenson, how would you describe the field of physical medicine and rehabilitation? A lot of people don't understand this,
yes.
and even the topic we're on here. So if you could enlighten us.
Absolutely. So physical medicine and rehab, which is also known as physiatry, it's somewhat of a unique specialty in that the main focus of it is really on functional status and then by extension quality of life. So as a result, we see a wide range of patients, oftentimes crossing over into other specialties. And the reason is that there's so many different conditions that can affect the way we go about our day. So this can range from traumatic brain injuries or other serious neurological conditions to more common conditions such as neck and back pain or joint pain. And those latter issues are the ones that Dr. Mack and I really focus on.
Wow. So, and Dr. Mack, how is it different than regular pain management?
So the difference is really the focus. So, like Dr. Stevenson was saying, that we really, as physiatrists, focus on function. We really do an in-depth evaluation. We have extensive training in both musculoskeletal issues, neurological issues, and so we're able to bring that background training into evaluating patients for really where the pain is coming from, and then being able to treat that with a number of different modalities, and that can include physical therapy and changes in lifestyle. One of the big differences between us and kind of classic pain management is that we're really focusing on non-opiate management of pain, and so really using all of our other tools effectively, which can include, like I said, physical therapy, other medications, injections. So just really a different focus.
Right. So I had read that your mission was to reduce pain and manage it, obviously, as you said, less opioids, which,
yes.
And then there's us who just say, well, take a couple Tylenol or an Advil or something and call it a day, but that right. obviously doesn't work all the time. So,
exactly.
Dr. Stevenson, what is your approach when you work with patients that come to you with an injury? What should they expect? How does this?
Sure. Yeah. So,
figure
for most consultations, the first thing we really do is get a thorough history. That's really the most important part, and ideally that's directly from a patient. So, when did this problem start? How did it start? We're very interested in things that make the symptoms worse, things that make the symptoms better, because that kind of helps us focus down on what are the issues, what are the barriers. So once we've gathered a history, we do a very thorough physical exam, and then in combination with that, we may order testing, x-rays, MRIs, blood tests, and once we're able to kind of narrow down on what the problem is, that's when we can formulate a treatment plan. And this can include a variety of things, as Dr. Mack had touched upon, but some of the more common things we prescribe or recommend is physical therapy referrals, lifestyle and nutrition counseling, Behavioral health services can sometimes be very effective for pain. And then, of course, we do a lot of different injections which are effective for symptom management. And medications as well do have their role. But again, we're trying to minimize the opioid use and kind of lean on other modalities if possible.
What's your typical, like, what do you see the most of? Or, what's a day in, day out what type of injuries in the types of patients, what do you see the most of?
Yeah.
I guess is really, because I'm just thinking back. I'm thinking back. Everybody has a sore back, right?
Yes.
So,
Yeah,
is
you're
that
right
it?
on.
Is it back?
That's the vast majority of our patients are neck and back pain.
Okay.
It's probably over 90%. But we do see, other peripheral joint problems. Osteoarthritis is a big one, particularly of the knee and the hip.
Okay.
Tendinitis, bursitis, and that can really involve any area of the body. So really any musculoskeletal or spine issue is really where our practice focuses.
And on that, when I think about people coming in, a number of areas, neck, back, osteoarthritis, a lot of people, they get a pain and they go to their orthopedic. They go to an orthopedic. They refer to an orthopedic, say. But you're treating the same things.
Yeah, we do have
differently, perhaps.
A big overlap with orthopedics, but the big difference is they're a surgical specialty,
right.
Whereas we're purely non-surgical. So a lot of times going right to an orthopedic, it might be the right move, but a lot of times surgery is a last resort.
Right.
And so that's sort of where our specialty fits in, right in between there, between family medicine and some of these surgical specialties.
Okay, interesting. Now, we mentioned low back pain, most common thing I think about with any of us. Dr. Mack, what are some of the options for treatment? You mentioned a few. If you could expand on those treatments a little bit, because people have no idea when you talk about injections. What do you mean injections? Give me a shot in the arm, my back feels better.
It doesn't usually work like that, but
so and I know that's people are hearing more about these injections. Even I've learned more about things, but we still don't understand why suddenly, how is this happening now instead of back surgery? Sometimes people, we used to be, you need your disc removed, or you need a disc replaced, or you need all kinds of things.
Right.
How is what you're doing, different, or what some of the treatments that people might expect?
Yes, and so there's a wide range, like we've been talking about, of things that we can do. So chronic back pain, so yeah, definitely the physical therapy and lifestyle things. And, we can also make adjustments. So some people, we often have people who come in and they say, well, I've done physical therapy and it doesn't work. And we can often make suggestions and modifications to continue to help with that, different medications. The injections, so like you were saying, there's a number of different kinds of injections, and it's not always, kind of clear on the options there. So when we look in particular at back pain, there's a couple different options. So, if patients have back pain and then they have leg pain, more of a pinched nerve type of picture.
Sciatica.
Exactly. So there's a different type of injection that would be indicated there. So that would be more of an epidural injection where we're putting medicine around the nerves that come out from the spine. But when we're looking at just back pain that's not going into the legs, that it doesn't seem to be a pinched nerve and it's maybe coming from little joints in the back, we have a couple of different options, which is nice. So we can do steroid injections into those little joints in the back, so similar to like a knee or a hip.
Right.
So we frequently do that. Steroids, we do have some limitations sometimes with how long steroids last, kind of 3 to 6 months.
That's what I was going to ask.
Exactly.
So what should people expect, right? If they're going through this, okay.
Yeah, so it doesn't always,
it.
Exactly. So there is actually a very nice procedure that we can also do that helps with pain that comes from the little joints in the back that's not steroids. It's a little bit more of a process, and the idea for that type of procedure is that there's little nerves, small nerves in the back that tell the brain what's happening in the joint. They're called medial branches. So we can do a test procedure first where we're putting numbing medicine on those little nerves, basically just stopping the signal. So the brain doesn't know about the joint and arthritis, and so you don't feel pain. Yeah. But it's only numbing medicine only lasts for a little while, so for a few hours. So people go and test it out, and we see if they have improvement, and then there's a follow-up procedure we can do that's called a radiofrequency ablation.
Oh, wow.
That is a special needle at those spots that we can heat up and burn those little nerves.
Wow.
So we're basically killing the messenger.
Yeah,
more permanent. Exactly. So, and that lasts a lot longer than steroids. So anywhere from 6 months, sometimes up to 2 years. So we
Nice.
get some good results with
So
that
many
type of
options
procedure.
compared to, yeah. that's
Exactly. Yeah.
amazing.
So people don't always understand that we do have some really good options for even things like chronic back pain.
Yeah. Well, great information, that's for sure.
Good.
So how do people go about, becoming a patient? Where does that, we talk about, they go to an orthopedic or they go to their primary, and then do they have to refer them? Is it something they can look up themselves? How do they understand what's
So
happening?
I usually recommend you always, the first line of defense is always your family physician, whether that be a nurse practitioner or the actual physician. They can kind of guide you in the right direction as to what specialty you may or may not need. It might be simple as, your family doctor referring you to physical therapy and you stick with the exercises, and that might be it.
Right.
But if they do feel you could benefit from a specialty like ours, we do ask that they send us a referral
Right.
to our office, and then our front staff will give the patient a call, and they'll set up an appointment. We're also, open for calls. Our front desk is great, and if you have any questions about our specialty or our practice, feel free to call or stop by the office if you want.
So that brings us to another point, the office. First question though, how long has Harrington had a pain management clinic or service?
So
how long would you
pain
say?
management has been around for a number of years. I'm not exactly sure, but physical medicine rehab really started when I arrived about 4 years ago.
Okay.
So before that, it was mostly anesthesiologists who very commonly specialize in pain management. And as Dr. Mack was saying, similar but with a different focus. So I kind of brought PM&R here about 4 years ago, and
Nice.
Dr. Mack joined us, 2 years ago now?
2 years in February.
Yeah.
Yes.
Wonderful. So that's a great coup here locally. So now we are UMass Harrington here in Southbridge, which gives us great access to there's a lot more benefits out there for people, but it's nice to know we have pain management right in Southbridge. You are currently at 100 South Street. You're in the Medical Arts Building, correct?
Correct.
But coming up, big renovation happening, I've been told. Little bird whispered in my ear. Can you describe a little bit what's happening and what next steps, next level that Harrington is going to give to the community?
Yeah, so right now our practice is a bit divided. So we see patients in our office, which is at 100 South Street, which is behind the hospital in the Medical Arts Building. And then for all of our interventional procedures, whether they be injections or nerve tests, those are done over at the hospital on the 4th floor. So the plan is to combine everything into one nice location at the main hospital, where we'll be able to kind of a one-stop shop,
Right.
if you will.
So that's going to be at 4 South, I'm told. 4 South
4
being the
South,
old
yes.
maternity area.
The old pediatrics,
Oh,
actually.
pediatrics, 4 South, pediatrics. Sorry, yes, I'm
Yes.
thinking of sorry, 4 South, pediatrics. But that's good, a great use of space.
Yes.
And when might, what's the projection? Because we all know with COVID and everything else, supply chains and all that, we know that we don't hold anybody to dates. But
Yes.
what's the anticipated?
We're hoping to cut the ribbon on January 1st, but
January 1st. Well, wait, that's pretty specific, but okay. Sometime in January, you hope.
January.
February, March. Great. Well, we hope that we'll be able to be there and see what happens with your new location. That's wonderful.
great.
So currently, if people want more information or to possibly become a patient, they would call you unless they have a referral situation and their doctor gives them the information. You are at 508-909-8590.
yes.
They can get some answers, see if they're in the right place, perhaps by calling that number. And you're currently located in the Medical Arts Building. So is there anything else you would like people to understand more about PM&R? It's a great acronym, or acronym? I guess that's the word. Yes. Gosh, I can't even think of it. Physical medicine and rehabilitation. Is there anything else you can think that directs them to you? Specific type of pain, specific type of ache. Is there anything else?
So I would say we're also really good for those cases and those patients where we're not sure where it's coming from, because pain can be quite
So you help to
complex.
diagnose
Yes.
where pain is coming from, because you might think
Absolutely.
it's a hip joint when it could be
Exactly.
a bursa.
Exactly.
right.
Okay, so
We're
all right,
great
that's-
with those
all right,
those
so
kind
that's
of cases.
good. So
yes.
absolutely, it's good to know. I mean, again, a lot of people watching have no clue, and this is the first time they're hearing about the ability to have something that might resolve something that's been going on for years for them. And so we're very fortunate again to have you.
Great.
I just want to thank you both for being here at
Thank you.
Southbridge Community Television. I've learned a lot. I think my audience has learned a lot. And we thank you for your time today. We look forward to the opening. Please let us come into UMass Harrington and check out the new location when it's available.
Oh, we appreciate it. Thank you.
Thanks for having us.
You are welcome, very welcome. Well, Southbridge, that wraps it up for today. We hope you've enjoyed this segment. You'll see information for the pain management clinic on this video. Feel free to reach out with any questions. And this is Denise Clements. Thank you again for joining us today.